So this morning we announced a leptospirosis outbreak in Jamaica. This is a requirement when you have more cases than normal, but it is also normal to have more cases after major flooding events. And given the fact that Hurricane Melissa was a major flooding event, the worst we've ever had, then the solid waste, the debris, the rodents, rats, and other animals that are infected would contaminate water and food, and you expect more cases. So this
A
is
surge in leptospirosis cases has been reported across Jamaica in the aftermath of Hurricane Melissa, as flooded communities grapple with contaminated water and poor sanitation. Health officials say the heavy rains and widespread debris have created ideal conditions for the bacteria to spread, prompting urgent public warnings for residents to avoid floodwaters and seek medical attention if symptoms appear. As cleanup efforts continue, authorities are racing to contain the outbreak and prevent further infections. Let's check the TVJ report on the matter.
To rebuild, there's been a host of issues: electricity, access to water, connectivity, you name it. But now another issue is piling on.
Jamaica is now experiencing an outbreak of leptospirosis.
From October 30 to November 20, 2025, there have been 9 confirmed cases and 28 suspected and probable cases. There have been 6 deaths among the suspected cases.
There are no deaths from among the confirmed or probable cases at this time. 8 parishes have confirmed and or suspected cases. St. Anne, St. Mary, St. James, Hanover, Westmoreland, St. Elizabeth, St. Catherine, and Trelawney, with additional reported cases under investigation.
The majority of cases are in the most affected parishes. Males are more affected overall.
Since the passage of Hurricane Melissa, there's been a heightened risk of exposure to contaminated water and soil.
The bacteria that causes this disease thrives in water contaminated by urine of infected animals, especially rats, but also cats, dogs, and livestock.
Now, considering the fact that many Jamaicans were in waist-high water, salvaging belongings in their flooded homes, and communities like Content in Manchester still inundated 24 days later, this is a concern.
Leptospirosis can affect anyone who comes into contact with contaminated water, soil, or mud. That includes farmers, persons engaged in cleanup activities, emergency responders, and others navigating flood areas.
In the meantime, some 5,600 PCR tests for leptospirosis have been secured and 100 point-of-care test facilities.
Majority of cases are mild flu-like illnesses, but you can have more severe presentations. It can involve the liver and the kidney, can also involve the brain, and can also involve the lungs, with bleeding in the lungs, and can lead to respiratory failure.
The minister, describing the approach as early and coordinated, says declaring the outbreak is important.
An official declaration signals to the health system that immediate action is needed to identify cases, to contain the spread, and to prevent severe illness or death.
The Health Ministry has consulted other ministries, including the Ministry of Local Government and Community Development, so cleanup actions can target communities that have seen multiple cases of the disease. Romarda Lyons, TVJ News.
As Jamaica battles to recover from Hurricane Melissa, a new crisis is emerging in farmlands and communities. Animals are struggling to survive. The Agriculture Ministry is pushing for field hospitals to treat injured and stranded livestock, warning that delays could spark a second public health threat. Antonia Atkinson has part 2 of our series, Melissa's Impact on Animals.
Across Jamaica's hurricane-battered farmlands, pastures have collapsed and livestock are roaming injured and sick. The Ministry of Agriculture says field hospitals are now urgently needed to save these animals and critically contain an outbreak in diseases. Dr. Sophia Ramlal, Director of Veterinary Services, says while relief supplies have been distributed to residents, neglected animals pose a second public health threat.
We are very much asking persons to provide shelter to provide feed and water, and those may be the owners or just good citizens, good Samaritans. We're also asking that animals not drink from contaminated water sources. We're also asking that animals not be allowed access to carcasses, because if they don't have normal food, they may be forced to eat what they can find. So where it's possible, not to feed carcasses to animals, not to feed food that we don't think is fit for ourselves to animals, because that will just lead to further challenges.
Flooded areas, dead animals, and contaminated waterways, these have created prime conditions for leptospirosis, a bacterial disease spread through animals' urine that can quickly affect humans. Several human cases have already been confirmed in Jamaica, and the risk is escalating.
There are known consequences of disasters like this in both people and animals. Without shelter, without food, without water, there are diseases that come along those naturally because they have no water and they may be drinking from sources of water that are not safe. We also have to think about common diseases, and a very topical one now being leptospirosis. So the same advisory that applies for humans applies for animals. Animals are not to be drinking water that is not safe, and generally we're asking that that messaging be very solid, whether it's human or animals.
Wound management is also critical. The public must be alert for screwworm cases. And as food supplies dwindle in several communities, authorities fear that desperate residents might consume sick or even infected animals, further spreading diseases.
Food security becomes important, but in all of that, we would not want persons to be indulging in unsafe food practices. And by that, what I mean is not eating food that has been waterlogged, not eating food that has been sitting outside for a long time.
Today's press conference is to announce that Jamaica is now experiencing an outbreak of leptospirosis, with an increase in the number of confirmed and suspected or probable cases reported across multiple parishes over the last week. The outbreak follows the passage of Hurricane Melissa, which has created conditions that have increased the risk of exposure to contaminated water and soil. Leptospirosis, as we informed the public during our meeting Let's Talk Recovery series on Sunday last, is a significant public health risk following heavy rainfall, flooding, or any major disaster. The bacteria that causes this disease thrives in water contaminated by urine of infected animals, especially rats, but also cats, dogs, and livestock. Leptospirosis can affect anyone who comes into contact with contaminated water, soil, or mud. That includes farmers, persons engaged in cleanup activities, emergency responders, and others navigating flood areas. The meeting last evening with my team confirmed that there are 9 cases that are confirmed, 28 suspected or probable cases, and these numbers are from October 30th, 2025 to November 20, 2025. The numbers reflect significantly more cases than the 2 to 21 cases observed in the preceding 34 months. There have been 6 deaths from among the suspected cases. There are no deaths from among the confirmed or probable cases at this time. 8 parishes have confirmed and or suspected cases. St. Anne, St. Mary, St. James, Hanover, Westmoreland, St. Elizabeth, St. Catherine, and Trelawney, with additional reported cases under investigation.
Hi everyone, I just wanted to speak to you about what's in the news lately. Jamaica has recorded a confirmed case of leptospirosis following the recent flooding from Hurricane Melissa. Well, leptospirosis spreads through contaminated water, and flood water can enter the body through the mouth, through gums, or your eyes. If you've walked through floodwater or helped with the cleanup and had any kind of exposure to that kind of water, you should only use boiled water or bottled water for brushing your teeth. Avoid flood water splashing onto your face and make sure it doesn't go into your eyes. Check for fever or red eyes or mouth sores or even bleeding of the gums. Anyone with these symptoms should visit the nearest clinic immediately. So stay safe and protect yourself. This message is very important, and I've been a dental surgeon for over 30 years. So if you have any questions, feel free to DM me or reach out to my office. Stay safe, stay clean, and protect yourself and each other. See you soon.